The sympathetic nervous system is also called the thoracolumbar division because it arises from the thoracic and lumbar regions of the spinal cord. It has relatively short preganglionic and long postganglionic fibers. You can see it here illustrated in green. The thoracic and lumbar regions are shown respectively in blue and red. The preganglionic neurosomers are located in the lateral horns of the spinal gray matter. The fibers exit the spinal cord by way of spinal nerves, thoracic 1 through lumbar 2. They lead to nearby sympathetic chain ganglia, which are also called paravertebral ganglia because they're right next to the vertebral column. There are a series of longitudinal ganglia that are adjacent to both sides of the vertebral column, from cervical to the coccygeal levels. You can see them shown here on either side of the spinal cord. Usually, there are 3 cervical, 11 thoracic, 4 lumbar, 4 sacral, and 1 coccygeal ganglion, and the sympathetic nerve fibers are distributed to every level of the body. So although the fibers exit only at T1 through L2, the spinal cord at levels T1 through L2, they may travel up or down through sympathetic chain ganglia to reach the various levels necessary within the abdominal cavity. Each paravertebral ganglion is connected to a spinal nerve by 2 branches or communicating rami. Here you can see a paravertebral ganglion. You'll see the white and gray communicating rami right here. One has a red fiber in it and the other has a bundle of green fibers in it. The preganglionic fibers are very small myelinated fibers that travel from the spinal nerve into the ganglion by way of the white communicating ramus. This is all myelinated. The postganglionic fibers will leave the ganglion by way of the gray communicating ramus. It's called the gray communicating ramus, and it's illustrated in red because it's unmyelinated. This ramus forms a bridge back to the spinal nerve. The postganglionic fiber will then extend the rest of the way to the target organ. So this is the general scheme. However, there are some variations. After entering the sympathetic chain, the postganglionic fiber could follow any of 3 different courses. Some will end in ganglia, which they enter and synapse immediately with a postganglionic neuron. Some will travel up and down the chain and synapse at ganglia on different levels. These fibers link the paravertebral ganglia into a chain. They're the only route by which ganglia at the cervical, sacral, and coccygeal levels can receive input, because as we already explored, we only see these sympathetic nerve fibers leaving between thoracic vertebrae 1 and sacral vertebrae 2. The third option is some of them will pass through the chain ganglia without even synapsing. They will continue as splanchnic nerves. We'll explore these in more detail shortly. The 3 possible routes by which the nerve fibers can leave the sympathetic chain are called the spinal, the sympathetic, and splanchnic nerves. Let's look at the spinal nerve route first. Some of the postganglionic fibers exit the ganglion by way of the gray ramus, as explained in the first example. This returns the fiber to the spinal nerve and it travels the rest of the way to the target organ. This is the route to most sweat glands, piloerector muscles, and blood vessels of the skin and skeletal muscles. Not the nerves that operate the muscles themselves, but the blood vessels within the skeletal muscles. The next route is the sympathetic nerve route. This is where nerves leave by way of the sympathetic nerves that extend to the heart, lungs, esophagus, and thoracic blood vessels. In the sympathetic nerve root, the postganglionic fibers leave by way of sympathetic nerves that extend to the heart, lungs, esophagus, and thoracic blood vessels. These nerves form a carotid plexus around each carotid artery in the neck and issue fibers from there to effectors in the head. This includes sweat, salivary, and nasal glands, piloerector muscles, blood vessels, and dilation of the iris. Some fibers from the superior and middle cervical ganglia form cardiac nerves to the heart. The final root is the splanchnic nerve root, where fibers that arise from spinal nerves T5 to T12 pass through the sympathetic ganglia without even synapsing. Beyond the ganglia, they continue as splanchnic nerves, which lead to a second set of ganglia called collateral or prevertebral ganglia. Here, the preganglionic fibers synapse with their postganglionic fibers. These collateral ganglia contribute to a network that's called the abdominal aortic plexus. It wraps around the abdominal aorta, as you can see here. It has three major collateral ganglia in this plexus. There's the celiac, the superior mesenteric, and the inferior mesenteric. These postganglionic fibers accompany the arteries and their branches all the way to the target organs. The solar plexus is a collective name for the celiac and superior mesenteric ganglia. The nerves that radiate from the ganglia come out like rays of the sun, hence the name. There is no simple one-to-one relationship between preganglionic and postganglionic neurons in the sympathetic division. Each postganglionic cell may receive synapses from multiple preganglionic cells, thus exhibiting the principle of neuronal convergence. In addition, each preganglionic fiber branches and synapses with multiple postganglionic fibers, thus showing neuronal divergence. Most sympathetic preganglionic neurons synapse with 10 to 20 postganglionic neurons. This means that neuronal divergence predominates. One preganglionic neuron can excite multiple postganglionic fibers that lead to different target organs. Thus, the sympathetic nervous system can have relatively widespread effects. Now, we have one more route to consider for stimulation, and that is stimulation of the adrenal glands. The adrenal glands produce a relatively unique situation called the sympathoadrenal system. Now, the adrenal glands are on top of the poles of the two kidneys. Each gland has two different regions, the adrenal cortex, which is a surface layer, and the adrenal medulla, which we'll find in the center. We'll examine this in more detail when we talk about endocrinology. The adrenal cortex will secrete the steroid hormones. The adrenal medulla is essentially a ball of sympathetic ganglia. It consists of modified postganglionic neurons. So those sympathetic neurons that are going to the adrenal gland will have no synapse until they reach the adrenal gland, at which point they synapse with this very specialized cell, which is essentially the postganglionic fiber. These cells secrete a mixture of hormones into the bloodstream. We'll see things like catecholamines, epinephrine, and norepinephrine. They also function as neurotransmitters, and they're released by neurons themselves, but they can have an endocrine function as they're released into the bloodstream. So this sympathoadrenal system is about the closely related functioning of the adrenal medulla and the sympathetic nervous system. Some texts will actually introduce these as 4 different ways. Here we had 3 ways: the spinal nerve root, the sympathetic nerve root, and the splanchnic nerve root. Remember, the splanchnic nerve root is where the synapse occurs in a collateral ganglion. These collateral ganglia could be anywhere throughout the abdominal cavity. And then the fourth way would be the adrenal root, where the presynaptic neuron bypasses the sympathetic ganglia and goes directly to the adrenal gland, where it synapses on a very small postganglionic neuron that exists within the adrenal medulla. Take a moment here to diagram out these four different routes that sympathetic neurons might take. Keep note of the preganglionic fiber and the postganglionic fiber. Again, to review, we can have the spinal nerve route, where the fibers simply exit using the gray ramus through the regular spinal nerve to reach the tissues. We then have the sympathetic nerve route, where the nerve may come up, synapse in the sympathetic chain ganglia, and move either up or down to the various organs. Then there's the splanchnic nerve route, where the fibers pass all the way through the sympathetic chain ganglia and synapse with a ganglia somewhere else in the abdominal cavity. And then the fourth way, again, the preganglionic nerve will bypass the sympathetic chain ganglia and continue all the way to the adrenal glands and synapse on the postsynaptic neuron, very short, inside the adrenal gland itself. So four different diagrams, or four diagrams put into one, as you might see in this image here. Take the time now to do this. It's important while it's fresh in your mind. Now, let's look at the parasympathetic division of the autonomic nervous system. It's also called the craniosacral division because it arises from the brain and sacral regions of the spinal cord. Fibers travel in certain cranial and sacral nerves. You may have heard of craniosacral therapy. This is involving stimulation of the parasympathetic division to bring calm to people's lives. You can see here the parasympathetic division is shown in green, arising from the brainstem as well as the sacral region. You'll notice that the origin of long preganglionic neurons begins in the midbrain, pons, and medulla in the cranial nerves, as well as from the sacral spinal cord segments S2 through S4. The long preganglionic fibers can be found in cranial nerves, as well as the pelvic splanchnic nerves and inferior hypogastric plexus. The terminal ganglia are in or very near the target organs. So we have a very long preganglionic fiber and quite short postganglionic fibers. Now, as we said, there was neuronal divergence and neuronal convergence. We'll see that the divergence here is less pronounced than we saw in the sympathetic division. That is, one preganglionic fiber reaches the target organ and then will stimulate less than 5 postganglionic cells, as opposed to what we saw in the sympathetic system, where we had a very wide spread effects. The cranial nerves that carry parasympathetic impulses are the oculomotor nerve, which allows the pupil to narrow and the lens to focus, the facial nerves involved in tears, nasal, and salivary glands, the glossopharyngeal involved in the parotid or salivary glands, and the vagus nerve, which takes the viscera as far as the proximal 1/2 of the colon, as well as the cardiac, pulmonary, and esophageal plexuses. So you'll note that most of the parasympathetic input goes to the rest and digest type of organs. You may notice that some of the organs have both sympathetic and parasympathetic inputs. We'll discuss this momentarily. The remaining parasympathetic fibers arise from S2 to S4. These are the pelvic splanchnic nerves and the inferior hypogastric plexus. Most form pelvic nerves to the terminal ganglion on the target organs, so the distal half of the colon, the rectum, as well as the urinary bladder and reproductive organs. Now, the digestive tract has a nervous system of its own that's called the enteric nervous system. It does not arise from the brainstem or the spinal cord, and it innervates the smooth muscles and glands of the digestive tract, so it functions all on its own without any input from the brain. It's composed of 100 million neurons that are found in the walls of the digestive tract themselves. There are no components in the central nervous system, and it has its own reflex arcs. So let's say when a bolus of food comes down through the digestive tract, it stretches the tract. As it stretches, this causes the neurons to stimulate the muscle to contract. So this enteric nervous system regulates the motility in the esophagus, the stomach, the intestines, as well as the secretion of digestive enzymes and the acid that breaks down food in our stomach. Normal digestive function also requires regulation by some sympathetic and parasympathetic systems, but it will go on alone purely because of the enteric nervous system. Hirschsprung's disease, or megacolon, is a hereditary defect where we have an absence of the enteric nervous system in the sigmoid colon and the rectum. Feces thus becomes impacted above the constriction and causes this condition called megacolon. This massive dilation of the bowel from feces that cannot pass through. It causes abdominal distension and chronic constipation. It can cause peritonitis, which may lead to colonic gangrene or even perforation of the bowel and leakage of materials into the abdominal cavity. It's usually evident in newborns who fail to have their first bowel movement. I once saw a documentary on a little boy that had this condition, and they didn't figure out until maybe he was 4 years old, but he would have constant megacolon, and then they would empty it, and it would fill again and empty and fill again, and huge abdominal distension and major discomfort. If somebody wanted to present on this, it's another great topic for your end of semester presentation, if you haven't picked one already or you want to do a last minute change. So do please take a moment now to diagram the parasympathetic as well as sympathetic nervous systems. Where do each of these fibers arise? Parasympathetic system, craniosacral. Sympathetic system, thoracolumbar regions. Which ones have long preganglionic fibers and short postganglionic fibers? So on and so forth. Take some time to get this stuff on paper. It is the meat of your diagramming assignment for this chapter.